There are a lot of differences between the patient base in China and in the United States in terms of entry-level patients, people who are not very sick. But I will tell you one thing is that the moment people have a real illness, everyone's the same. They want to get better, they'll do whatever it takes, and they will trust you if you've got skill, right? If they have that. And so interestingly in China, what was fantastic about treating the migrant workers and farmers for free was that they wanted to get better fast. There was nothing good for them to be stalled. So in places where you have workers' compensation or they have 10 treatments or they don't have to go to work, who wants to get better quickly? But a migrant worker who's being paid by the hour, by the day, they're desperate. And so they come in and they want the medicine to work and they want us to do a good, strong treatment. And then you have wealthy Chinese who are educated, and they're the ones who basically funded our clinic. And these are people that we have to explain ourselves to in Chinese, in an educated manner, being able to really explain the medicine. And then you have the young Chinese, and it's amazing how many young Chinese, the first exposure they had to Chinese medicine was with a Westerner, because most young Chinese have never used Chinese medicine. In the West, what happens is we come in and that entry-level patient who's never had Chinese medicine before also has no cultural context. And so how to explain what we're doing in a non-esoteric, metaphorical way so they understand and yet don't get lost or think it's a little strange is a very different skill set. And then the patients who are more discerning, who've had Chinese medicine before, is how can we get them to understand that what we do is very different from what they might have experienced for years elsewhere. And so it's a very different interface of conversation. But the moment we move to the people who are really sick, and so they've got a broken bone, they've got very serious lupus, they're having acute asthma flares, they have something that's at risk, they're hospice cancer patients, then it doesn't matter. They're all the same. They want to get better, they do what it is, they want to learn about it, but they are committed patients. And one of the gifts I found is that once people are sick, people are people, and it doesn't matter anymore where they're from, what they've had exposure to. They need good medicine, they respond to good medicine, and there's no strangeness about it. They trust their doctor.